Hi, I'm Michelle Turner from Movement Lessons, and I'm here to talk to you about breathing. Breathing is something I'm very interested in because I have chronic issues with my son, as well as I see a lot of patients that have issues with breathing, and sometimes they don't know about it. So what I'm here to talk to you today is about when to realize that you might have a problem with breathing, or that you can find a more efficient way to breathe. And that's what Movement Lesson is all about, is to give you a more efficient way to move. And breathing is movement, as well as how your brain functions, to how your bones function. Movement's life. So one of the things that you can do to see if you're breathing okay is to actually just look at the way you breathe. Now you can do this in front of a mirror, or you can just do this standing, but feel what it's like just to breathe. So just stand there and just see how you breathe. Now most people maybe will expand the belly. And I'm looking at just, first of all, to get a baseline, how you would normally breathe. Don't suddenly go, that's not how you breathe. And also with breathing, I shouldn't hear you breathe. Now granted, if you were just hiking a mountain and so forth, you're going to be huffing and puffing. However, if you're just sitting there and talking to me and having to do a breath and explaining things and talk, that's not proper, and that's something you should talk to first with your doctor to see about your breathing. Heck, for $35 you can go to Walmart and get what's called a pulse ox. You can just check your oxygen level. That's something good to have too if you have concerns for apnea. You know, first thing when you wake up in the morning, if you're getting up in the middle of the night, throw that on your finger and just see where your oxygen level's at. Might give you a little bit of an eye-opener. Really, anything below 95 to 93s especially should throw concerns up that you might have to supplement either with breathing treatments or getting help for your breathing. So, and again, I'm not a doctor, but something to keep in mind. So after you look at the way you breathe, and again, it's probably really shallow, maybe your belly's out, you know, not much going on. Now I actually want you to purposely to expand the chest when you're standing there. So just feel what it's like to breathe. Now if you're just expanding the chest, and again, I'm not going, you know, it shouldn't be that much work to take in air. And if there's coughing involved, what if this is just hard to do? If you just don't know how to expand your chest, those are concerns. Concerns to learn how to move better, to find someone, a practitioner to work with you, or like I said, to go to a doctor. And now, keeping the feet straight in this direction, but you want a little bit of a twist. Now, if this is difficult for you, I don't want there to be balance issues, then fine. Go off to the side, but then turn the head this way, because you're looking in a mirror, you're looking, but in this way, so if you're just turning, and now look what it'll take to expand the chest. And again, if this twist is difficult for you, or you need balance, or you need to hold on to a counter, which is fine, I want you to be safe first, those are things you might want to look at, because that means I can't turn this way and breathe at the same time. That's a lot of work for my brain. And it shouldn't be, because guess what? This is getting out of a car. So if you're getting out of a car and actually like grunting, or what they call making, you know, old people noises or whatever, no offense, then you're not breathing. Anything you're going, ugh, to do something, your breath's stopping. So not only do you have difficulty moving, but you have difficulty moving and breathing at the same time. And then after you do it this way of expanding the chest or expanding the belly type thing to look at the way you're breathing, try it on this side. And again, like I said, if that's difficult, then stand with the feet this way, but look this way. So there's still a little bit of a twist involved. And then see what it's like to expand the chest and expand the belly. And if anything of those things are causing you difficulties, again, go to a doctor first to just make sure that, you know, there isn't something going on, or you might need some breathing treatments to get you back to a place where your chest isn't as aggravated. It could be allergies, it could be lots of things. And also, when you're looking this way, look at the way you stand. Now, notice I'm not back like a soldier. That's not standing up, because guess what? If someone pushed me here, I would fall down. So, but I'm standing on my system. I'm going up and down. I'm not wobbling. I'm on my system. Just look at the way you have posture. just this, just that little bit. Now expand the chest. Where does the breathing go? Just that little bit of curvature to your system, and then again to the belly. It just changes who you are structurally. And that again might be something to talk to a movement specialist to look for. Is there a way of getting the spine more active, to bringing the system up? So the chest cavity, here is a different place to breathe versus here. And also, every inch the head goes forward, that's an extra 10 pounds. It's fatiguing. When I'm tired, do I breathe well? I don't do anything well when I'm tired. So those are things to take a look at your structure and say, hey, maybe it's just time for a tune-up. And that's what I tell a lot of my clients. I don't see my clients all the time. Yes, some I see on a more frequent basis because they have neurological conditions that I have to compete against. But at the same time, typical people after 3-5 lessons, maybe max, when you're thinking about me, it's time for a tune-up. And that could be 6 months out, 8 months out, whatever is comfortable for the person. But that's time to maybe look at where you're at and say, I need a tune-up. Because remember this, we always try and improve things we're good at. Things we're not so good at, we really don't work to improve. And breathing would be something to keep good at an efficient level. Because don't forget, let's say I just sprained my ankle, talking about hunching over. Okay, I've sprained my ankle, so now I'm like this. Again, when I'm trying to protect even just that conversation with the ankle, look at where my chest is. Do you think I'm breathing well here in this position? So it's not necessarily an ageism. You could have had bad habits. Again, it could be a bad allergy season. It could be too hot that you're used to. There are different things that affect breathing. But those are just something to look at in your own system to see what you can do to be more efficient at. And breathing is something really to look at, to be more efficient at. So I hope this helps you do these little tests. And let me know if you do need help from someone in your area. I can see if I can find someone for you, or come visit me. Thanks.